Welcome back. Now, what comes to mind when you hear the term oral health? You might picture toothpaste and a toothbrush, maybe even clean teeth. But what if I told you it involves far more than ensuring you don't have bad breath? Well, your oral health can have far-reaching effects on your overall health. And the reason this is our topic tonight is because this week we marked World Oral Health Day. Well, this year, like every other year, the goal was to educate and remind the public about good dental practices. And joining me in studio is Dr. Liz Wibo, who is a dental surgeon and the national treasurer of the Kenya Dental Association. But before we unpack our topic tonight, let's take a look through a few facts on the state of Kenyans' teeth. Now, according to the World Health Organization, just 42% of Kenyan adults report brushing their teeth twice a day, which is critical in ensuring good oral health. About 15% of Kenyan adults aged 15 to 49 have severe gum disease, which can lead to tooth loss and affect overall health. And over 30% of Kenyan children aged 12 have untreated tooth decay, which can negatively impact growth, nutrition, and development. Thank you so much for joining us, Dr. Liz. Let me begin with the most common oral conditions that you kind of find in Kenyans today.
Yeah. Thank you for having me, Victoria. And of course, this is a really important conversation. We often overlook the oral cavity.
Yeah.
So some of the top oral diseases we see is, of course, cavities. This is a hole in the tooth, and gum disease. So these are the top two, but we have a myriad of other diseases. So we have oral cancers, we have other malformations, we can have cleft lips, cleft palates. So it's a whole wide topic. And right now, today, I think it will be important for just to have a conversation to educate each and everyone to ensure that we can prevent these oral diseases.
I came across some really worrying statistics. Over 90% of Kenyans, this is adults and children, experience bleeding gums. What causes that?
Yes, so bleeding gums is as a result of accumulation of plaque and calculus in the mouth. So this occurs when you don't brush your teeth. So believe it or not, about 24 hours after you brush your teeth, the saliva hardens the dirt that is on your tooth, and it becomes too hard for you to remove with your toothbrush. So that now necessitates the need for you to see an oral health specialist so that we can remove the dirt. So the bleeding comes about as a reaction of the body to try fight off this irritation. So the body is feeling there's dirt, there's plaque, and of course there's bacteria in this plaque, so the gums are irritated. So a lot of blood rushes there, and the blood, now of course when you traumatize it a bit during brushing, you get bleeding gums.
Well, you just mentioned it. You know, most people go to the dentist when oftentimes it's too late. You have a toothache, it's time to maybe remove it. And for that reason, people fear going to the dentist. The pain, oftentimes the cost. You go in for one thing, you find there are several other things you have to deal with. But how do we demystify this relationship, if you will, with patient and dentist?
Yes. So it's important, first of all, to establish this relationship from a very early onset.
Yeah.
And oral health diseases, especially dental caries and gum disease, are often preventable. So if you're keen and you follow our advice in terms of your diet, in terms of brushing and the frequency, then you'll be able to keep these diseases at bay. So what is important, and another important aspect, is for you to have constant monitoring. I'll give you an example. It's really hard for you to look at your teeth every single day. But when you have someone else look at it, we'll be able to identify problem areas. So when it's early enough, we'll tell you, no, I want you to focus on brushing your upper right tooth, or I want you to focus on your lower molar. I'm really worried about it. Yeah. And again, that brings about the frequency. So if I say, come see me after 6 months, then I'll be able to monitor. So that's why, again, we also recommend having a dentist who follows you up, because we'll be able to notice such minor changes. So when we're heading towards a cavity, I'll say, no, before it gets too big, let's intervene. And also during these visits, we talk about your diet, we talk about your brushing habits, and we even go through it and just show you exactly how you should do it.
I have to go to something that you hear a lot of people complain about when they go to the dentist, and it's, you know, if I have an issue with my tooth, the thing is remove it. And that happened to be a very old school way of dealing with teeth problems. Is it something that still persists, or has that changed over time?
It has changed over time, because now we are keen on function and, of course, aesthetics. So when we remove our teeth, of course, we're compromising function, and by function, we mean your ability to eat. If you look at it, life expectancy is also increasing, so meaning we're not losing teeth as quickly, or we're not willing to lose our teeth quickly. So that means we want to take care of them and have them in our mouth for as long as possible. So we're seeing a change in that, especially in urban areas, but we still need to get this information to everyone, because despite you having a toothache or a tooth that's very badly broken, the tooth that God gave you is the best. So whatever replacement options we may give you after the fact are not as good as your tooth. So right now, as the dental fraternity, we're focusing on saving the tooth as much as possible. When this cannot be done, then we can talk about replacement options, so that we make sure we don't compromise on function or aesthetics.
You mentioned something really important. The tooth that God gave you is the best, and it's the only tooth that you have, because, you know, when a tooth breaks or chips, it doesn't regenerate like other parts of our body. So, you know, how critical is it for people to take care of, and what can they do in terms of preventative measures?
Yes. So 2 key areas we focus on is diet and brushing habits. So our diet, of course, not just a balanced diet, but we add in an extra aspect, a non-chorionic diet. So this means a diet that does not encourage the formation of dental caries, which are holes in your teeth. So these are our cookies, cakes, biscuits, sodas, juices. So we have to be really careful with this. So what I advise my clients, of course, we cannot all go, you know, cold turkey on it, but you can reduce the frequency. And how we can do this is, say, at least once in 2 weeks, you can have your meal cheat day and enjoy your cookies or your cake. So we've reduced the frequency. That way we are not eating it as often and increasing the risk of cavity formation. The other aspect of it is brushing. So a good rule to remember is 2 by 2. So you brush 2 times a day, brush and floss in the morning and in the evening. And you also brush at least for 2 minutes. So not just quickly going through it within 30 seconds and you're done. No, just take your time, brush every surface of your tooth, so that you ensure you're not leaving anything behind. Other than brushing, again, very important to floss. And we have some other adjuncts in the market, like the water floss, which makes it a lot easier to floss your teeth if you find the string a bit more cumbersome. So if we follow this, and now we are adding another aspect, visit your dentist at least 2 times a year, then you'll be assured of you having healthy teeth throughout. So I understand the anxiety related to visiting the dentist, but what I tell my clients is, after the first initial round of treatment, say we see 4 cavities, we deal with the 4 cavities, now we're dealing with maintenance. So you're just coming in for cleaning, and I'm monitoring, and I'm ensuring that everything still looks good.
I have to talk about affordability, because that is something that people feel is a preserve for someone who can actually afford different dental procedures, if you will. How do we make dental care more accessible and affordable for those who really need it, but it's an out-of-pocket affair for many?
Yeah. That's a really good question, and I'd like to say it's a bit multifaceted, yeah? So it starts all the way from our training institutions. We only have 2 training institutions in Kenya.
Yep.
That's your N and Moi. So we need to increase them so that we can have more dentists coming out. Beyond that, we need to ensure that when our dentists graduate, they're adequately posted for internship. After this, of course, they need to be absorbed and posted in various working stations. So now, as it is, posting for dentists across the country, it's not the best. Yeah. So we don't have these services reaching the people in the grassroots. So we really need to focus on this, work on healthcare staffing, especially for oral health providers, so that it reaches the people in the grassroots, not just having one dentist who's in the public facility and the rest who are in private institutions. So this will really work on the affordability aspect of it. So just to mention again, with the Kenya Dental Association, we also partner with some companies, and through these partnerships and of course grants, we go ahead and have oral health camps where we perform screening. So we will look at a population, like a month ago we were in Lamu. So we performed screening and treatment of the people in Lamu. So these activities are supported by some of our partners and also grants. So this is our way as the association to also give back to the society and make sure we're getting this information to those who need it, and also the right treatment and oral health care that they need.
Let's talk about a condition that we've seen. I remember growing up, at times you'd see people or children with discolored teeth.
Yes.
And oftentimes you wouldn't know at the time, but it's exposure to high levels of fluoride, for instance. How do you deal with that situation? Because a lot of times people feel, if I brush my teeth hard enough, you have people in the industry who've taken advantage of others and use very harsh chemicals to try and whiten the teeth. But how do we deal with that problem?
Okay. So now there's dental fluorosis, and we also have discolorations on the teeth. Right. Yeah? So first things first, it's important to get the correct diagnosis, all right? Because each discoloration can have its own specific treatment, okay? So a lot of times, and what you're alluding to, people taking advantage, is the diagnosis and the treatment are not matching. So dental fluorosis is not generally treated by whitening, but you may get other conditions that will benefit from whitening. So it's important, when you're in doubt, visit a dentist, get a diagnosis, because without a diagnosis, you won't get the correct treatment that will benefit you. That being said, it's also important for us to be keen on the fluoride levels within the water that we take. So we have institutions that are working hard to educate the public on fluoride levels and how to make sure your household is not exposed to that. So again, visiting your dentist is important, because some of these signs we see earlier on, or we may be able to see it before the rest of your household is affected with the same. So it's important, again, at the end of the day, visit the dentist whenever you're in doubt.
And my last question to you, because I see you have your tools here, because this tends to also affect kids quite a bit. Their teeth are still forming, and they're probably not getting the adequate, nutrients at that stage in life. But how do you properly brush? I mean, it seems like a simple question, but critical in getting ahead of some of these issues we've been talking about.
Correct.
Yeah.
So first things first, I think it's important, once your child starts teething, visit the dentist. This will serve 2 purposes. We will educate you on how to properly take care of your child's teeth. We'll also go through diet counseling. And the other thing is, the child will also get comfortable with the dental office, with the dentist, because remember we said we want you to come in and visit the dentist at least twice every year. So we don't want these visits to be traumatic. So if you'll allow me,
sure.
I'll go through this. So we normally have the really tiny washcloths. I think you've seen the ones that come in a care pack for children. So this is a bit bigger. But what we want to do is you just wrap it around your finger. This is for babies, especially who don't have teeth yet, or they're just starting to get their teeth. It's also important for us to cleanse their gums. So you just put your washcloth, wrap it around. You can use some warm water and just rub around the gums.
Okay.
So this is just a nice way to cleanse. The other thing that this helps is the child will get used to cleansing the mouth, having something in the mouth to help them cleanse. So I always get parents who say, no, my child does not want me to brush their teeth. So this will be a good way to introduce cleansing to the child as they grow up. So the more the child grows up, then we start introducing brushing. So I know as a parent, you always struggle with doing it yourself and of course fostering independence. So I tell my patients, let your child have the toothbrush, do their thing for 2-3 minutes, and then for that 1 minute they'll allow you in the mouth, just do a thorough job so that you make sure whatever you need to do in terms of getting the dirt out, you're able to do it within that time frame. So I'd like to just go through brushing techniques, of course, for adults, so that we have a more comprehensive view of what needs to be done. Yeah.
Right.
So ideally, we would like you to brush your teeth using what we call the modified bus technique. So this, you'll use your toothbrush and just angle it towards the gum, and 2 to 3 teeth, just a slight circular motion while you brush downwards, all through the surfaces. So you'll go around to the other side, work on the inner surface, just the same way, 45 degrees. And the reason being is we want to get the bristles to the gum area so that we get all the dirt out. And then we'll clean the surfaces of the teeth, of course. And another aspect where we normally forget is the tongue. So don't forget to cleanse your tongue. Yes.
There's a question here from a viewer who asks, is severe gum disease treatable, and how would you help a smoker with his or her teeth hygiene?
Wonderful question. Thank you for that. So yes, it is treatable. You'll visit a dentist, will be able to examine. Most of the time in severe periodontal disease, which is gum disease that has progressed, we normally assess and see the degree of bone loss. So from this, we can be able to prescribe treatment according to the need. The other thing is, for when you're a smoker, it actually makes gum disease worse. So I'll advise, first things first, let's stop smoking. So this will just increase your overall quality of life in general, and of course your oral health.
Another question here said, I've plucked out 8 or have 8 teeth plucked out. How does this affect my old age? I usually have difficulty flossing the teeth that haven't been filled in.
Oh, yes, this is, of course, unfortunate. 8 teeth is one too many. So I'd encourage you, come for a visit. We have a look. The reason why we always recommend replacing your teeth after them being removed is the teeth are held in position by the opposing tooth. So there's a bit of a balance. The teeth on the upper jaw help stabilize the teeth on the lower jaw. So if you remove one, we have what we call drifting and tipping, which just aggravates the situation in terms of you're not able to brush certain surfaces. So I'll advise this viewer, come visit the dentist, let's have a look, let's have a plan on how to get you back to 100%. But of course, all hope is not lost. We can always do something.
Another one here, because we had promised to answer this question on how oral health affects the rest of your body, essentially. So why is it so critical that you take care of your oral health?
Very, very important. So we'll start with the basic nutrition.
Right.
If you don't have teeth, you won't be able to adequately get the nutrition that you need. And nutrition affects you in a myriad of ways. We know diseases that are associated with certain nutrient deficiencies. So it's important for us to be very keen. Nutrition has also been linked to your IQ. You know, just when you're hungry, you can hardly, you don't even think or focus, yeah? So that's just from the basic, just looking at it. We also say that the mouth is the window to the body. So you can actually see certain diseases in the mouth. So we call them oral manifestations of certain diseases.
Right.
So diseases like Kaposi's sarcoma, which is a kind of lesion that we see in advanced HIV and AIDS, or diabetes, we can see it in how severe your periodontal disease is. So your mouth really interconnects with your body in ways that you cannot really see in the forefront. You have to be very keen to ensure your mouth is healthy, and of course that is a reflection of the rest of your body. So the other aspect of how a happy mouth is a happy body is another part of your body we hardly look at, which is your mind. So I think you alluded to it a little bit. When you don't have teeth or you have discolored teeth, this will affect your self-esteem, your confidence. So you'll find your child is having a conversation, or they're hiding the teeth during conversations, or smiling in pictures is a no-no for them. This at times with children in school, even answering questions in class, you know, they're averse to it. So if you look at it, your mouth affects you in totality. So it's really, really important for us to actively take care of it. The other thing is, when you have a toothache, you'll be looking for your dentist at 6 a.m. Everything else stops. So it's important we don't let it to get to that point where everything grinds to a standstill because of a toothache, but just being proactive, making sure we don't get to that level. So it's really, really important to have that. And as the result, your whole body will also be happy. We
have lots of questions coming in. I think someone was quite keen on the issue of fluoride in our water and, of course, the effects it has on our teeth. But there's also fluoride in toothpaste. Yes. And so there's always this debate of, so if it's damaging to our teeth, why is it in toothpaste? How do you make that clarification?
Yeah. So there's a nice saying that says too much of anything is poisonous, yeah? So it's the same thing. The fluoride in toothpaste is within the recommended parts per million. Yeah. So this amount is protective to your teeth, and it helps the teeth become stronger and, of course, help fight cavities. However, when you ingest too much fluoride, then it destroys the tooth structure. So now you'll end up with the enamel that is a little bit weakened in its structure. We call it mottled enamel, which will also give you that discoloration. So the conversation should be how much parts per million are you ingesting. So if your water is within this recommended range, then that's good enough. You can continue with the water. But if it is beyond that, then you can look at filtration devices or explore other avenues to ensure you're not overexposing yourself and your family.
So how much toothpaste is too much toothpaste? And someone is also asking, do the brush bristles damage the enamel as well? So if you have a toothbrush that is a bit too hard, for instance.
Yeah. So for children, we actually recommend a pea-sized amount, just very little. Yeah. For an adult, about half the length of your toothbrush, not too big, just a very small amount. That's more than enough for you to take, for you to use. Sorry, I forgot your other question. The second part of the question?
Yeah, if you have a toothbrush that is a bit too hard, yeah.
Yes. So that's a really good question. So hardness of your bristles is also really important. We don't want you to use a hard bristled toothbrush. We want it soft. So generally you'll see in the packaging on the top, it'll be written soft, medium or hard. We don't want you to use a hard bristled toothbrush. Reason being, the gum is right next to the tooth and you'll be brushing there. So if you're too hard, then it's almost like you're just constantly scratching that area. So what will happen is the gum will move away from the tooth. So this will then expose the root surface, which is a bit softer, and this can cause damage. So definitely we want, as we are doing the technique that we've discussed, make sure your brush is also soft or medium in its bristle texture. And also don't use too much force. Just gently cleanse your teeth. Some
very concerned parents watching tonight. I don't think I've gotten these many questions on Citizen Weekend, but let me combine these two. One parent is saying, my 4-year-old child has holes in his teeth. How do we address this? And the second question is, their 1-year-old has black stains on their teeth. How do they clean them? And does this relate it to sweet and sugary foods? So I guess we can start with the holes in the teeth first. Yes. So for children, as we discussed, it's really important to introduce cleansing as early as possible, and this is 2 times a day. The other challenge is, of course, diet. We want to be keen that the diet is not too full of sugary foods. So at times you'll find the porridge that we give our children has a little bit too much sugar. I've had parents who put sugar in the water, you know. So this all just compounds to creation of cavities in our children's teeth. So what I'll advise parents is, let's visit the dentist. The challenge with oral diseases is you cannot diagnose remotely. We have to see and tell you what exactly is happening. So don't be afraid. As I said, when in doubt, we have dentists all over who are willing to help. So visit your dentist. Let's have a conversation. If what we're lacking is brushing, we will advise you on brushing techniques. If what we're lacking is on diet, then we'll advise on diet. And we will be able to restore these teeth so that your children can eat adequately and have sufficient nutrition, and walk with you through the path to make sure even as we shed these baby teeth, the permanent teeth will come into a healthy environment. So the black stains on the teeth? Well, this is a 1-year-old, so I guess they haven't formed their their permanent teeth yet. Still too early. So at times we see some form of staining. We call it extrinsic staining in children. So I don't want to really comment and diagnose remotely. Until you actually see. Yes. So if she can get access to a dentist, I'll recommend that, but nothing to be alarmed at this stage. You just talked about using the towels for younger children to clean the gums, but there's also the dental kits for kids that have a silicone kind of tool for cleaning the tongue and the gums as well. Is that okay? Yes, so with technology, we're getting more advanced in cleaning your teeth, So the take-home message is ensure you cleanse your children's teeth in one way or another. So you don't need to have those silicone molds at toothbrush. So these molds may not be accessible to everyone. I know even some of our viewers are wondering, what are these molds? What are you talking about? But just your trusted toothbrush and a toothpaste is more than enough. Great. That is all the time we have before this turns into a diagnosis session. Thank you so much, Dr. Liz, for coming in. And clearly a lot of concern among Kenyans in terms of taking care of their teeth, and just the knowledge that you've imparted tonight. We really appreciate it. Thank you. Let's take a short break here on Citizen Weekend. Sports news is coming up next. Stay with us.